recently had a young gal with me from Louisiana State University, and she's a fourth year vet student there. And it was interesting to me, what sometimes can be scary to me or concerning is so many of the things that I do in my practice. She had no idea what I was talking about, and I often make the comparison of, you look at prescription diets in veterinary medicine, and you have these big companies, Hills and Science Diet and Royal Canin and Mars, and they do a lot of research, they do a lot of work on their products and to promote what they do. Yet, so often they're not the right product for my patient in what I'm looking for in a longevity and wellness situation. Welcome, everybody, to Pause, Reflect, and Heal podcast with Dr. Randy Aronson. I am that person, and we welcome you to the podcast today. We've had some great listener feedback and some great questions. I want to remind you, you can reach me at www.drrandypetvet.com. Articles, podcasts are there. All of the questions and comments that you have, there's a telephone number you can call in on voice over internet, or please feel free to get a hold of me. But love to bring your questions to the show. We have had a lot of interest about what we're going to talk about today, and I'm very, very excited to have a very good friend of mine, and probably, I think, the leading expert in this area in veterinary medicine, my good friend Jonathan Lowe from O3 Vets. Jonathan has a great history and can really feed us some great information about this topic. And, we really want to develop this so that people understand why this exists in integrative medicine, why people are using it, what the future is. And of course, this is all about healing your pets and longevity and wellness, which is what we address all the time on Dr. Randy Pet Vet. So, Jonathan, welcome to the show.
Hey, thank you so much for having me. I'm excited to talk to you.
Absolutely. So, Jonathan, tell our listeners a little bit about your bio and your past. I hate reading bios, but I love you to kind of introduce yourself and tell them exactly where you came from and what brings you to this point now, and then we can talk a lot more about Ozone and, of course, about O3 Vets.
Cool. Well, I won't go all the way back to where I came from, but I am human, and I'm, in all seriousness, so it kind of started as a family affair, and so I got into this area of ozone therapy probably about 12 to 13 years ago, so it's been over a decade now, and was working on the human side with some of my family members, and then I recognized pretty quickly on that nobody was doing this for animals, and in fact we were working more with ultraviolet blood irradiation, which is it's a different treatment, but it works in synergy with ozone. And we were going to some ozone conferences because those were happening all around the U.S. and the world for human medicine. And we were, working on that other stuff, and I realized very quickly ozone was a very powerful modality. I was listening to a lot of lectures from these MDs and PhDs and different people, naturopaths and different doctors who are using this in human medicine. I was pretty impressed with how they were using it, from joint injections to cancer treatments to different longevity related preventative medicine techniques and stuff. So I was like, wow, this is really powerful. And then I went to an AHVMA conference, a holistic veterinary conference, which I'd never been to anything like that before on the animal side. And there was nobody promoting ozone therapy, except for a few veterinarians who kind of were doing it themselves in their clinics. And so it just kind of snowballed from there, of just seeing the opportunity, the need, and trying to fill that niche.
So when you got that information and you were, obviously very impressed with what was out there, What was the next step for you? I mean, what happened from there to jump to you actually creating your company, O3 Vets?
Well, yeah, like you said, is first seeing that as a powerful tool. And so I experienced some of that myself. I had some injections for my knee. So I think oftentimes we get things done for us. And then when we have it done for us or our pet and we see the power of it, then we're all of a sudden convinced. It's a funny thing because we can look at 100 medical studies that say, hey, this is what happened. But until it actually happens to us, we often don't really believe it or don't pay it much mind, at least. And so the next step for me after that was just starting to develop, go to some of the veterinary events and develop some equipment and protocols that would help veterinarians implement this in their practices.
And I may comment that Jonathan does this very well. The ease of someone like myself who had no experience in ozone many years ago to where we are today using it, almost daily in our practice is pretty incredible. I love your story about your injections because people often ask me on my integrative side, like, how did you bring this into your practice? And I go, many times it was me, many times there were things that I was missing in my health and wellness. I looked at them, I looked at the research and a lot of times in many modalities, we don't get the double blind studies that we really want scientifically because, most people can't see how to capitalize. I give the example often about garlic. No one's going to do a double blind study in animals to show that garlic is a great immune helper. But because, if they did that, they wouldn't be able to make any money selling garlic. So, often that's where these things get driven, as you know. But, people like you and myself look at these things and look at, what's happening. And we, often we have to go outside of the U.S. Because of FDA constrictions and stuff like that. Look at what's happening in Cuba or Russia or in Europe and pull that information. And you've done that incredibly well. So congratulations, because you made me a believer very quickly, and then for me, experiential medicine, every day using it and seeing what it can do for my pets it has been such a godsend. So again, thank you for that because it really is great.
And just to add on to what you're saying, I appreciate that. I feel indebted to you and to other veterinarians like you because. You are the type of person who will accept a treatment at face value for what it can do. Not that you don't look at the research, of course you do, but it's not like, well, I haven't heard about this at, I live right next to Michigan State University, so I haven't heard about this at MSU. So I'm not going to really even pay it any mind. I'm not going to think about the fact that it might be helpful. I deal with and interface with different professors and veterinarians who think that way, and I'm sure you do as well. They won't listen to anything unless they've heard it from their university or a higher source. Whereas it's hard to find a veterinarian. There's not that many of them like yourself who think outside the box to begin with and are willing to just say, this is common sense medicine. It works. I'm going to provide it.
Right. And thank you for that. I agree with you. And it's funny because I often have fourth year students from all over the country shadowing me. And I recently had a young gal with me from Louisiana State University, and she's a fourth year vet student there. And it was interesting to me, what sometimes can be scary to me or concerning is so many of the things that I do in my practice, she had no idea what I was talking about, and I often make the comparison of, you look at prescription diets in veterinary medicine and you have these big companies, Hills and Science Diet and Royal Canin and Mars, and they do a lot of research, they do a lot of work on their products and to promote what they do. Yet, so often they're not the right product for my patient in what I'm looking for in a longevity and wellness situation. And I think, we could attribute the same kind of things to ozone, really, and some of those therapies. And I'm always looking for, as you know, I'm always looking for that protege that I can turn on to all the things that I've learned because, I was just talking to a really good friend of mine, an integrative MD, and you've got to pick and choose to bring it into your practice. It's not readily available. It's not, I'm not going to be able to go to a course on nutrition and say, oh, we need to get these simple carbs out of that diet. We need to improve the quality of their protein. Do you know what I'm saying? So it makes it a little bit more difficult, but I'm glad that there's us around, you and I, and all the people like-minded that are promoting, and it's getting bigger. That's what I love to see. I had a conversation a couple weeks ago with Dr. Gary Richter, another founder in the integrative world in veterinary medicine, and we definitely see it growing. And the nice thing is that things like this podcast brings the public into the fray, and they're saying, well, maybe I should really be looking for someone who can do this because my pet is doing this, and this, and it may have applicability.
Yeah, absolutely. And I just saw a statistic recently that said only about 6% of veterinary clinics offer integrative care, and 64% of pet guardians want integrative options. So, yeah.
Yeah. It was interesting. I think I did a national radio show for 10 years, and we talked so much about some of these things. And so often, the listener would say, God, I didn't know about, let's say ozone, or I didn't know about the uses of vitamin B12 in this situation, or biome research. How come my vet doesn't do that? And I'm always in a little bit of a tight spot when that happens. And I go, because everybody's comfortable in what they do and what they know and what they want to look at. And, sometimes it does take looking outside the box, like you mentioned, to really bring some of these things in and give us some great treatment modalities. So I want to ask you to talk a little bit about ozone, because, and I know if you go on the internet, the first thing that comes up is FDA says ozone's a toxic gas. And that's the first thing that client hits me with is like, did you see what the internet said? And I say, I try not to because we know better. So let's talk a little bit about ozone and what it is and then we can talk about its uses and stuff like that.
Sure. Yeah. Well, that's a great starting point. Thank you for bringing that up. It is a toxic gas. It is a toxic gas.
Right.
That's the problem. And if their statement stopped there, it would be okay because that's true. And I'll explain that.
Good.
It's not something that we want to breathe in. Ozone does irritate the lung lining. So the fault of antioxidants to protect the lungs, the absence of enough antioxidants to protect our lungs, makes it hazardous if we breathe too much ozone at high enough concentrations. So that's one of the ways we don't administer ozone is by breathing ozone gas. That's what we want to avoid. Now, everybody breathes a little bit of ozone every day. It's just in our environment. The question is how much. I kind of liken it to smoking a cigarette. You smoke a cigarette and it's not going to kill you. You smoke it for years and years and years, and it could really damage your lungs. So yeah, it is a toxic gas if we breathe it in like that. We don't administer it that way. And if you go on with that statement that the FDA has, they say it's a toxic gas with no known medical use, because if you wanted to use it in the doses necessary to inactivate the pathogens in the body, you would basically kill the person or the animal. So they're likening, or they're viewing ozone therapy as only an antimicrobial. And they're also talking about ozone therapy as an antimicrobial that you would apply internally, which is not how it works. When we use ozone externally, we can use it as an antimicrobial, and it can be used safely that way. in oils and in fluids and sometimes in limb bagging. And we can talk about those methods in a minute. But
Sure.
when we use it internally, we don't use it as an antimicrobial. We use it as as something that helps basically the cells communicate better, that provides a stimulant. We call it oxidative preconditioning, which basically just means that we're putting a little bit of oxidative stress, controlled oxidative stress on the body, which in turn kickstarts a cascade of positive effects, production of antioxidants, the kind of kickstarting this redox signaling mechanism that helps the cells communicate between each other to turn off or turn on different transcription factors that say, hey, you need to produce interleukins, or hey, you need to produce these heat shock proteins to protect the body. That's what ozone does internally. And so the FDA just showed that they really probably didn't care to speak the truth about this.
Right.
They just want to shut it down. And so they make
Right.
this statement in the 70s, and they haven't changed it since.
Yeah. It obviously, as you and I know, that could be quite damaging for those of us that know its great benefits and whatnot. And we're going to explore more of that as we talk, obviously. You went to, you had experience with your own situation. And then the thought was, with O3 Vets, let's create this company where we can supply this information to veterinarians along with, the equipment that's necessary and the safe practice. And when those of us that are enlisted in O3 Vet and we use the things from Jonathan's company, there are books involved, there are pamphlets involved, there is equipment that's very safe and easy to use in the practice. And it really makes our life as veterinarians and veterinary technicians great to be able to administer this product. One of the things that was interesting, Jonathan, and I don't know if I shared this with you, but a dear friend of mine who I've done some podcasts with is an integrative MD here in town, and he went all through Frank Schellenberger's course in Nevada, and he shared that with me early on. Dr. Schellenberger, if people don't know, is kind of, I call him like the godfather of MD Ozone. I'm sure that there's probably other people that stand out, but in our world, close to the United States, this guy is using this, all the time, and getting incredible results. So it was such a confirmation for me. Like, here I am looking at it, talking to you, going to conferences, learning more about what ozone can and can't do. And then, here is my MD friend who's using it for joint injections or along with prolotherapy, in acupuncture points. And it was just totally fascinating how it kind of spiraled for me.
Yeah. I mean, that's one of the real benefits of ozone therapy. You just talk about some of the ways it can be administered. And I think that's a relevant discussion here for your listeners, because if you bring a pet to Dr. Randy, let's say, or to other veterinarians like him, you can administer ozone in 14, 15 different ways to date. And that makes it very versatile and very user-friendly. So when a dog comes in and they have osteoarthritis, we can do joint injections or even rectal insufflation or major autohemotherapy. We can do some systemic ways of getting ozone to the patient, which helps to decrease inflammation. And we can do some local ways of getting ozone right into that joint, let's say, to also help to decrease inflammation and increase oxygen utilization and uptake into the body. And so it's effective in a number of disorders. I would say anything that has inflammation associated with it, which some people say that's everything. But inflammation is a huge issue, and it's a central issue for many diseases. And so I think ozone has a real place in medicine, period, not just veterinary medicine, to help patients live better lives, and even preventatively to help people and pets who are healthy to live healthier lives and longer lives. And so, man, you want tools like that in your toolbox.
Yeah, no question, no question. I think the next place to go for this conversation, if it makes sense, is maybe talking about all the different applications. And I know there's so many of them. And
Yeah.
maybe then we can kind of circle back to certain conditions that seem to respond, very well to this situation and kind of how it's used. So
Yeah.
would it make sense to talk about application first, or do you think?
Yeah, sure. So I like to separate them into two different categories, systemic and local.
Okay.
And so systemic ozone therapy is for like cancer patients. It's for patients who have a chronic autoimmune disorder, maybe. It could be a metabolic disorder sometimes. So those things that are more chronic conditions usually. It could be diarrhea and vomiting, then we don't know what's going on really.
Sure.
That's a possibility as well. But in those cases, we'll do rectal insufflation. It's just infusing ozone gas rectally, which is really good for absorption. So suppositories actually are more effective than pills because the absorption through the rectal colon lining is so good. Same thing with ozone gas. So we can do it that way, super simple way to do it in the clinic or sometimes at home. Some
Right.
pet guardians are doing it at home. Major autohemotherapy is removing blood and infusing it with ozone, putting it back in the bloodstream. That's another way we do it systemically. And then subcutaneous ozonated saline is another way we can do it systemically. And then you get into, there's ways you can only do it in the clinic. You can't do it at home, like intraperitoneal. So you do an injection.
Yes.
Intraperitoneally, and that's something that can be done that's been effective, and it's one of the ways that it's used in the lab, of course, because it's a easy, fast way to get ozone systemically for like mice and rats. So they'll do it in
Sure.
studies oftentimes.
Sure.
They'll do it in the vet clinic though as well, and the same thing with joint injections into the knee, into the hips, into the beside the spinal cord sometimes. Paravertebral injections. There's some easy ways to do it. Ozonated saline topically for hot spots, dermatitis, wounds, rash, those types of things, or ozonated oils. Ozone oils are the only thing that will actually capture and hold the ozone for an extended period of time, because ozone's a gas and it's a reactive gas, so it breaks down really quick. So in gaseous form or in when we infuse it into like saline, it'll break down in 30 minutes to an hour, and then you can't use it. But when we bubble it through an oil for an extended period of time, the oil has what we call double bonds, and it traps the ozone as an ozonide, which is a less reactive form of ozone, and then you can use that oil topically for years. So that's an easy way to apply it. There's other ways we can apply it as well. But those are a few of the more common ways that we'll use it in the veterinary practice.
Right. So when we talked about some applications, which we just mentioned, and I think my question or a question we've had is, do you have any idea how many people in the United States are incorporating ozone into their vet practice right now?
Yeah.
Any idea on a guess?
Yeah. So there's over 80,000 veterinarians in the United States. Okay. So that gives you an idea of the number. Now, of those 80,000-ish, well, there's maybe about 5,000 that are a little bit more holistic minded or integrative minded. And then of those, let's say the vast majority of ozone veterinarians are more holistic or integrative at this point, because it's not something that's taught in the universities to date. And the FDA has that one statement that doesn't help. But so of those 5,000, you're looking at probably less than 500 who use ozone therapy. So that means that, you have some states where there's 30, 40 veterinarians who'll do ozone, and some states where there's zero. And so there's likelihood, that you won't have somebody awful close to your house that does it.
Right.
And that's unfortunate.
And just as an aside, if someone was interested in finding a veterinarian like myself who did Ozone, do you at O3 Vets keep a registry and kind of help people locate somebody if that's possible?
Yeah. So if you go to o3vets.com, right in our main menu, there's a Find a Vet tab, and you can find a veterinarian who does ozone therapy, hopefully, in your area. That's the best place to find them.
Okay.
Yep.
Makes sense. I think another thing that always helps understand some of this is maybe talking about some cases or some examples of success stories. I know you get them all the time. I certainly can list some also. Maybe we could talk a little bit about, since we've talked about application and the different modes, maybe we can talk about some case examples that people might say, well, would it be applicable for my dog with cancer or would it be applicable in osteoarthritis and then I would love to talk about some of the preventative stuff or proactive stuff too with it.
Yeah. It is a very, very powerful tool. So I say for the vast majority of cases, it is something that could be a missing piece of the puzzle for you. And there's some pretty amazing cases that we've seen through the years. At the same time, I want to give that with a caveat and say it doesn't cure every pet. And in fact, I talked with a lady yesterday who called. We did a quick Zoom meeting, and her dog was right there on her lap. And we always encourage. I myself am not a veterinarian, so we work with veterinarians. They typically send clients to us to get ozone therapy equipment if they're going to do it at home, let's say. And so in this case, there was a malignant melanoma, oral melanoma that was just massive, and I'm not a veterinarian, so I don't give them veterinary advice. But in those types of cases, I'm very cautious in saying, yeah, this is gonna do it for you, because I don't want to give false hope.
Sure.
But man, there's some. One of the stories that I love that stands out is a guy by the name of Dan Aarons, a veterinarian who's now retired in Texas, who came to one of our training courses, and he gave me this testimony. He's like, yeah, we got ozone in, and we had this cancer case come to us. It was a cardiac cancer that had metastasized to the lungs and the liver, and it was just really looking hopeless because it was spreading so quickly. And he said they had an ultrasound done that confirmed that at Texas A&M, and then it's like, well, we can try this. It's a new tool for us. We want to give it a shot. So they did ozone with the ultraviolet, which we work with as well a little bit. Yeah. And they did 5 treatments, which isn't a standard protocol, but they did 5 treatments that first week, I believe. And then
wow, okay, a lot.
Yeah,
that's a lot.
so it was a lot. It was a lot. And then they did, I think, 1 or 2 treatments per week for the next couple weeks. And they had it ultrasounded again, and they couldn't find any cancer. It was miraculous. It was really incredible. Another case that comes to mind is there was a Sheltie, just a young Sheltie. It was 16 months old, I think, and it had polyarthritis, myositis. It was just really, really painful. An autoimmune disorder, it seems like, was going on, something there. They couldn't quite get the handle on it. Had been feeding it tons of, standard medications and different oral and IM and, everything, kind of hitting it with everything. And she responded positively for a few weeks and then just started to go downhill, from there. And they're like, well, this is euthanasia time. We can't sustain this. And so they brought her to a integrative veterinarian who said, let's try ozone. And so they started doing treatments. I believe it was, again, I think this might have been rectal insufflation, and it might have been major autohemotherapy they were doing. Sometimes it's a combo treatment. It depends on the case, but they started doing weekly treatments. And after 4 weeks, this dog started to be able to wean off medications that it was on. After 8 weeks, they fully weaned her off the different medications she was on. She became pain-free and actually went forward into the rest of her life, the last I heard, and was very healthy and was able to lead a normal life. And those are the types of cases where you just look at it and you say, Ozone is doing something pretty remarkable.
Absolutely, absolutely. And as you alluded to earlier, I mean, not every case will respond like like that heart, a chest cancer case.
Yep.
But we definitely see, I mean, there's no question that there's a huge advantage. And as you know, like in my practice, we work a lot with biome. We work with a company called Animal Biome, where
Yep.
we're looking at good and bad bacteria in the bowel. And in humans, this has now been considered a new organ. The biome is actually considered an organ in the body because it's so important. The trillions of organisms that are involved in how we feel and how we act and how we proceed. And we use ozone in conjunction with fecal microbiome transfer. Because ozone gets the biofilm out of the bowel, even before we do the procedure, and so it's much better accepted that way. But we also follow up with additional ozone therapies after, and it's just been miraculous in so many cases of chronic gastrointestinal issues. We use fecal microbiome transfer or animal biome for all of our allergy cases, and we incorporate ozone in that therapy, both topically, as you mentioned, for hot spots and flare-ups, but also either subcutaneous saline administration with ozone or rectally. It's really been a real godsend because, as you said, inflammation is really it's something that I've gotten to really focus on. That I just have to key in on all the time in my patients. And so in combination with getting some of the simple carbs out of their diet and making sure they're getting quality protein and making sure they're on the right supplements, ozone's been a great addition, which really has been fascinating to see how it evolved for us.
Yep, absolutely. And I was talking to you mentioned Animal Biome. I was talking to one of their representatives who recently integrated ozone therapy into their practice. And I'd been talking to this guy for a few years about it. And he finally kind of was like, yeah, we're ready to get that going here. And a few weeks after we got it going, he's like, Jonathan, I've been talking to you about this for years. He's like, you weren't lying about what it does.
Right.
He's like, and that was really
Right.
encouraging and validating for me to hear him say that, because he was excited about some of the things he was seeing in their patients when they decided to add that to all of the other tools that they have there, including the microbiome therapy that they do, the fecal transplants and whatnot. So, yeah.
Sure. So, I think one of the questions that come up for me, and I'm sure people might want to ask this question is, there obviously aren't are there standard protocols for certain types of cases? I mean, because sometimes I have a question on how often do I do major autotherapy, or how often do I do intraperitoneal injections? You know what I'm saying?
Yeah.
Do you have a feel for that in some of these situations, and do you consult with veterinarians as far as developing a protocol, let's say?
Yeah. Well, I won't lie. Sometimes I have those questions too. Medicine's always evolving. We do have standard protocols in place. Now, I've went back and forth on this particular topic because there's lots of medical studies out there. There's hundreds, if not thousands, of medical studies on ozone therapy in the human and animal world. And the protocols are going to vary in the different studies. And all we have to go on, right, is just what they choose to do in the lab or in the clinic or whatever and say, hey, that worked. But is it better than this or not? You know, and sometimes we don't know. And sometimes we do know. And so I would say what I've gone back and forth on is ozone is a natural biological modifier. It helps the body do what it does just more efficiently and better. It helps, reset sometimes the terrain and help the body to, maybe kick it back a few years to when it was a little healthier and operating a little bit better. Sure. And when you think about it in that way, in my opinion, oftentimes it's not quite as crucial that we get uber precise on some of the dosing. And some of the ways that it's administered. Sometimes it's 6 one way, half a dozen the other. Just do it. And other times it does seem to make a difference, for sure. Right. So I don't want to say that all the time at all. I think we need to be aware of, what we can expect. And so there's some studies that'll show when you're dealing with more chronic conditions, you may not see certain aspects of ozone therapy. We're coming to fruition and showing an effect until the 15th treatment. Now that's not normal, right, but that's where we're talking about maybe the production of stem cells or different things at a really biological level that you won't be able to necessarily see in the clinical practice. But there are things like that. And then other times, we're treating something that's transient. It's acute, and it's just 1 or 2 treatments that are necessary. And yes, there's a dose, we're going to do it at, 30 micrograms and we're going to infuse, 50 milliliters. And so it's to this point, it's not quite as much condition specific. So like, for example, we're not like, okay, for cardiac cancer, you're going to do this. For hemangiosarcoma, you're going to do this. For kidney disease, you're going to do this. And for, like osteosarcoma or whatever, osteoarthritis, let's say, you're going to do this for the knee and this for the hip and this, it's not that specific in general yet. I hope that we'll get there in that maybe we can see, okay, you do need 6 injections when you have this, or just 2 when you have this here, and you need to put it, in right here as opposed to periarticular. You're gonna, go intra-articular. There's some studies, but we don't have quite all of the data yet.
Okay, that makes sense. And and I think that you another thing that you've spoken about, which is really true, is we're all learning and we're all kind of getting an idea of how it might work and how it be incorporated. And of course, like in our situation, there are lots of cases where I wish I could do it every day. But clients have schedules and we have schedules, and then sometimes it just doesn't happen that way. But certainly every time that we've incorporated into a treatment, we've been very happy about how that's gone. And it doesn't it doesn't cure everything in the world. It's not it's not that, but it certainly is a great addition to what we can do. A question on kind of that situation is what's happening, kind of now or in the research world or experimental world with ozone. Any thoughts about new studies going on or things that you've seen that are really showing a lot of promise?
Well, there's certain countries that are doing a good job at putting studies out.
Right.
The problem is the United States doesn't always view those favorably in that we have a superiority complex, right, about our research here, and we don't accept the research of certain countries. But, I have a good friend and a very good ozone therapist in Brazil. And in Brazil, in veterinary medicine, ozone therapy is pretty much standard of care now. And so they do a lot there, and they do a lot of research. I think it's got application everywhere, which makes it hard to nail down.
Sure.
But if you're going to go look at the research out there, what you're, I'd say, going to find is that for the most part, we have literature that's really quite conclusive in the areas of osteoarthritis, damaged ligaments and joints, that discs, herniated discs and that type of thing, where that's where the most research is and the best research is. But then you'll go from there, and you'll find it in infectious disease, a lot in infectious disease, and there's a growing body of research. There's about 100 studies each year coming out the last 4 or 5 years on ozone therapy, and so there and not in one particular category. It'll be all over the map as far as what's being done. But I am excited about the fact that more and more research is being done. I would love to see if we had the funding or the interest from certain universities. I would love to see some of that research coming from the United States, which is lacking right now.
Yeah, I agree. Tell us a little bit about, we have a client, and she's interested in doing, or he is interested in doing ozone at home. How does that work through O3 Vets? Obviously we make the recommendation.
Yeah.
Can they reach out right to you and contact you about equipment and that type of thing? Is that something that you will do at this point?
Yeah. Yep. Absolutely. So we've set up a program that just really partners with the veterinarian to make it as easy as possible for somebody to do it at home and the veterinarian to not have as much work to do to make that possible. So we have an online training course that kind of assists that individual in understanding ozone therapy and understanding how to operate the equipment, so that when the veterinarian says, hey, you should do this at home, why don't you talk to O3 Vets? Then we can easily set them up with what equipment they need and the training that they need to take some of that burden off of the veterinarian as well. And usually it's about an hour. We do a live Zoom meeting most of the times with those people as well, just to, once they get it in, to say, yeah, it's set up right. Okay, let's help you kind of figure out what you need to do and even how to administer it. And so it's not like taking a pill. It's not that easy, but it's also not overly complex. So
yeah, definitely. I absolutely second that, and it really isn't that difficult. And it does, many times we'd like to see, multiple times a week administrations, if not even daily. And it's just very difficult for a client to get to the practice. It's very difficult for us to clear time to make it all the time. So having that availability. So I do want to mention, you can reach out if you have any questions for me, obviously, drrandypetvet.com. But if for Jonathan at o3vets.com, is it info at, or what's the easiest way for someone? Okay, I figured that's what it was. Info at O3 Vets. It's a great site. A lot of information, a lot of explanation about equipment and whatnot. And obviously, we want to make this available to anybody that's interested. So, this is very, very important. What's on the horizon for O3 Vets? Anything new and coming, or that you could talk about? Or
so we're working a little bit to get more into the equine space. So that's large animal. So we're working on that and some products that would make it a little bit easier there, as well as, to be honest, another large animal aspect of this is getting it approved for use on organic dairy farms to help with mastitis and metritis and different infections that they have there, because there's not tools for that. So those are a few projects we're working on. We always have every year we do an online summit for pet guardians. And so that's coming up in October, end of October for us. And it's free. So anybody can join. And there will be a link on our website to be able to register for that. If you miss it this year, we'll have one next year. And we have the same thing for veterinarians. So a separate one that's a more veterinary focus and a little more technical, usually in the spring. And then we do training classes. We have one coming up in September, end of September for veterinarians. And so there's a few different things on the horizon. And so, yeah.
Absolutely. Hey, Jonathan, thank you. I can't thank you enough. I mean, this was just great, great knowledge. So much fun to be able to turn people on to this technology and this work. And we're both focused on the same thing. We want all of our pets to live well and have, as much longevity and wellness in their life as possible. And so our pet guardians can live well. And they might even consider, getting Ozone for themselves, because there's lots of reasons to consider that. That's for sure. So thank you for your time. I mean, I really appreciate all you do, as you know, and everything that you've shared with us and made our clinic even more successful all the time with Ozone. That's a great thing to have.
Well, likewise, it's an honor and privilege to be able to share with you. I've always appreciated, Dr. Randy, how you have a focus on scientific advancement in medicine and yet integrating these tools that are less utilized. And so I appreciate the opportunity. Obviously, this helps us to be able to get the word out. So thank you.